Hello, and welcome to the Psychology 107 Real World Assignment number 3 for Dr. Smallman by Kelly Dray and Sarah Kinne. We have decided to talk about Charlie from Perks of Being a Wallflower. In the movie Perks of Being a Wallflower, Charlie is an average adolescent in high school. Following the death of his aunt, whom he deeply loved, he finds it difficult to be emotionally vulnerable with others. A very avid reader, he excels in school, yet he has a hard time making lasting social connections due to his shy and introvert nature. After being molested by his Aunt Helen as a child and then being what he considers the cause of her death, Charlie develops PTSD, or post-traumatic stress disorder. Required symptoms for PTSD are re-experiencing the event through memories, avoiding reminders of the trauma, and increased anxiety. Additional symptoms include anger and irritability, guilt and shame, substance abuse, depression, and suicidal thoughts. Charlie experiences flashbacks, increased anxiety, and avoidance of things that make him remember the events that transpired between him and his aunt. He also encounters suicidal thoughts, feelings of guilt, and depression. The following are two examples of some of his symptoms. First, frequent flashbacks. Charlie constantly thinks back to the brief memories of the molestation. Charlie also continuously remembers the moments before his aunt's death because she died on the way to give him a birthday present. The other example, negative thoughts. Because of the flashbacks, Charlie finds it difficult to form new, intimate relationships with friends. When his crush places her hand on his thigh, he remembers when his aunt performed the same action and freaks out. When his dearest friends leave for college, Charlie remembers the guilt he feels for his aunt's death and the memories of the last time he sees her on her way to get him a birthday present. We have decided that Charlie would benefit best from talk therapy, a form of counseling in which the patient speaks freely to the counselor and is encouraged to remember the events of the past in a safe environment in order to develop effective calming mechanisms to prevent anxiety in the future. Because Charlie experiences his symptoms due to a flashback, and in many cases the flashbacks are the symptoms themselves, talk therapy would provide the greatest benefit to Charlie because the counselor would be able to encourage Charlie to challenge his negative emotions into healthy acceptance. We hope this therapy will allow Charlie to grow into a positive adulthood where he can confirm solid relationships with close friends and possibly a relationship free of fear of intimacy with his crush Sam. And that was our diagnosis of Charlie from Perks of Being a Wallflower.